Medical misinformation can spread faster than ever, especially with more people turning to artificial intelligence and social media for health advice. A new KFF poll finds about 1 in 3 adults are using these tools to answer medical questions, but are they getting reliable information? We are now joined by Alex Montero, a senior survey analyst for the Public Opinion and Survey Research Program at KFF, a nonprofit that does polling and research about health policy. Alex, what's driving people to these digital platforms instead of talking with their doctor?
Yeah, so when we look at the users of both social media and also AI chatbots in our polling, we find that one of the top reasons that people give for using these is convenience, right? They want quick or immediate information or advice. At the same time, too, though, we do see that difficulty affording and accessing care is also driving some people to use these platforms. So in a recent poll, we found that nearly 1 in 10 adults who are turning to social media for health information cited not being able to afford seeing a healthcare provider or not having one as a major reason that they relied on social media for health information.
When is AI a helpful starting point, and when does it become a dangerous substitute for medical care?
Yeah, it's a great question. I think whether or not an AI chatbot can be a useful tool for a person could really only be, understood on a case-by-case basis. In our recent poll looking at people who use social media for health information, we found that very few, about 3 in 10, say they're regularly following up with a doctor after turning to social media for health advice. In another recent poll of AI users, we similarly found that, particularly when it comes to use of these tools for mental health advice, most users are not following up with a doctor afterwards.
And really have to be careful there. The poll also found younger adults, uninsured adults, Black adults, and Hispanic adults are more likely to rely on AI for health information, with many citing barriers like cost of care or difficulty getting an appointment. What does that tell us about the gaps in our healthcare system?
When we look at use of social media for health information, we certainly see that larger shares of Black adults, Hispanic adults, lower income adults, younger adults especially, are turning to social media for health advice. When we look at use of AI, a lot of those demographic differences actually are a little more evenly keeled, though we do see that younger adults are much more likely to be turning to AI. A decent share of both social media users and AI users are citing these kind of cost and access barriers to care. Again, about 1 in 5 on both of those fronts. And I think what this shows, particularly at a time when healthcare costs are rising for many adults, is that difficulty accessing and affording care can be pushing some people towards these tools. But I think it's worth noting that a good chunk of the public, about 4 in 10, say they lack confidence in their ability to tell whether information either on social media or AI when it comes to health is true or not. So I think a lot of people may be walking away from these platforms confused and uncertain. It's difficult for them to tell whether the information they're seeing is true or not.
Yeah, it's definitely getting harder and harder. Alex Montero with KFF, thank you so much for joining us.
Thanks for having me.